Go.
All right. Getting hand hygiene. Hi, my name's Jenna. I'm a student nurse today. I'm going to be working with Val. So I'm here to just check on your newborn, do a newborn assessment, just make sure that they're developed and that there's no issues. Do you have any questions before we get started? No? Okay. So how is breastfeeding going? Is it going okay? All right. How often are you feeding your baby? About 10 times a day? That's perfect. That's what we expect to see. And when was the last feed on the baby? Okay, about 20 minutes ago. Okay, I'm gonna put that up on the board and put my name on the board as well. So the baby's sleeping here, so I'm gonna come up slowly. I'm gonna assess respirations before I wake the baby up. And so the respirations should be between 30 and 60. It's about 40, and that's great, to be expected. I'm gonna assess just the facial symmetry right now while the baby is still sleeping, and the eyes are the same, a correct distance apart. It looks like the corner of the eye matches up with the ear. That's good. So now I'm gonna go ahead and try to take the baby's pulse at the apex and try not to wake them up. Okay, and the pulse is normal. And the baby was weighed about an hour ago, and the baby is at a normal weight for their age, for the gestational age. So now I'm going to go ahead and unwrap the baby. And so I'm just, again, looking at the face. The nares are open. The face is symmetrical. I'm going to brush my pinky along their cheek for rooting reflex, and they root. I'm going to stick my finger at their mouth, and they're sucking on my finger. So while my finger's in here, I'm going to feel along the roof of their mouth to make sure that the hard palate and soft palate are intact. If they're Epstein pearls. And so now I'm looking at the eyes, and there's no evidence of jaundice. There's no discharge. The whites of the eyes are a little red from trauma from the birth, and that's okay and to be expected. So now I'm going to feel for the fontanelles and just feeling if it's sunken or raised, any swelling in the head. The fontanelle's flat, and that's what we like to see. The sutures are well approximated for vaginal birth. So that's good. So now I'm going to come down and just assess respiratory effort. It looks like the baby's breathing without any issue. The chest is symmetrical. At this time, I'm going to do the startle reflex. I'm just going to clap and try to scare the baby. The baby should fan out like this. Now I'm going to listen to lungs as well. I would listen to the lungs, and the lungs sound clear. I'm going to listen to bowels, and there are bowel sounds. Ask the mom how your diapers are going. Has the baby had a bowel movement yet? Are they urinating as expected, and assess that. And it's all normal. So now I'm going to check the arms, and the arms are symmetrical. I'm looking for like one palmar crease, and I do see one. I'm going to check the grip reflex or the grasp reflex. And the baby grasps my hands. I'm going to check brachial pulses, and they're present and normal. Now I'm going to, and while I'm doing this, I'm just assessing the skin for any like birthmarks or melanin spots, any rash, anything like that. So I'm going to cover the baby up to keep him warm, and then move down to the legs. And the legs appear symmetrical. I'm going to check for femoral pulses. Okay, and then I'm going to do the Babinski reflex. So I'm just going to take my finger up the side of their foot, and their foot should fan out. I'm going to do the toe grip reflex and put my fingers next to their toes, and they should grip onto my toes. Okay, so legs are symmetrical. I'm going to take a look at the urogenital area, and this appears to be a female baby. And so the hymen tag is present. There is a vaginal opening. So that looks good. Okay, put that diaper back on. Okay, now I'm gonna lift the baby up and check that stepping reflex, and they're stepping, so that's good. So now I'm going to gently roll them over on their back, just to look at the back. And their spinal column is straight and intact, no evidence of spina bifida, no cysts or dimples. I'm making sure that the anus is patent, and it is. I'm gonna pull that back up, maybe take a listen to the lungs on the back side here. Okay, roll the baby back over. wrap the baby back up. I'm gonna make sure that the ID tag and security tag are on the baby. The baby it's just the baby in the crib. There's no stuffed animals or anything. Their bulb syringe is in the crib with them. And explain to the mom the importance of sleeping alone on their back in the crib, and having that bulb syringe in there. Ask the mom if she needs anything before I get out of here. Do my hand hygiene and like